We are at the New Jerusalem Baptist Church in the Carthage neighborhood in Cincinnati, Ohio, talking about vaccine equity today. And I'm joined by a panel of experts who we assembled because they have reach in the community and they have hearts very close to this issue. So what I'd like to do first is I'd like each of you to please say your name, who you are, and what your connection is to this story. And if we can start with you, Eddie.
Sure. My name is Eddie Cohen. I am President and CEO of Urban League of Greater Southwestern Ohio. Our organization has been around the community for over 70 years. Our role in vaccination equity has been to tell the community you have a right to live. Right? There's a lot of focus on hesitancy, but not enough on those who want access. So we have fought hesitancy by getting more people of color, more black people vaccinated. And it's been a tremendous reward and struggle throughout this last year.
Barbara.
I'm Barbara Lynch. I am the First Lady of the New Jerusalem Baptist Church and also one of the co-chairs for the First Ladies for Health. So I've been involved on both fronts in this COVID-19 pandemic battle that we have had. Getting our people in our congregation to not be afraid to take the vaccine and getting their family and their friends vaccinated, as well as being a co-chair for the First Ladies for Health, being involved with the 40 churches that are affiliated with our organization, getting them to get into their congregations and get people vaccinated also.
All right, on to the good doctor.
Hi, I'm Dr. Stephen Wilson. I'm an internal medicine and pediatrics physician at Mercy Forest Park. And I see my role as being an educator and advocate. Educator by doing the research on the studies and communicating that to the patients to show them that the vaccine is safe and most importantly efficacious. But also advocating, making sure patients in our Forest Park and Fairfield communities have access to the vaccine and that we can get them in a timely manner.
All right, and to our media voice.
Hi, I'm Tropikana. I'm a media personality here. I work at 101.1 The Wiz. I do middays daily from 10 to 3 there. More importantly, I'm a mother, and that is why I am so passionate about COVID-19. I've been utilizing my platform and my brand to bring awareness to COVID-19 to my target demographic of 18 to 34-year-olds here in the city.
Very quickly, I want to flash back to a year ago. And if you reflect on the year that's been, how would you describe it? And anybody can jump in and start.
I would say devastating. I mean, it has truly devastated our community. Beyond the people who've died no longer with us, we're talking about people who were in the hospital for multiple months, coming out, not being able to work. We're talking about kids being out of school, a lot of the mental health challenges, increase in drug abuse. This has just devastated our community.
We've seen a lot of grief also, and had, as leaders of a congregation and an organization, had to be with people who are losing their loved ones, who've lost their way of life, who've lost their jobs. And there's been grief on all fronts. And it's been very devastating, as you said, for us also, even though we've not been personally touched by the COVID-19, but seeing people around us being touched by it.
Oh, lots of people around you, I'm sure. Would either of you like to weigh in?
This year has been exactly what he said, devastating, isolating, and just a year of perseverance, of really having to push through and to make a way kind of out of no way for a lot of people.
And Eddie?
Yeah, I would think of this year not only devastating, but also a year of being entrepreneurial, a year of being forced to slow down and change at the same time. You think about I've experienced personal loss, and I've also experienced the change of slowing down and being closer with and intimate with the family members that are here. On this backdrop of all these incredible numbers and things that have happened that have been devastating, it's also has really forced us to really think about what's important in our individual lives, I believe.
And I have to imagine that what's important is the preservation of life. That's the most important thing. And it has come up here, and it has been something that we have reported on in our newscasts. The African American community has been hit harder than most communities by COVID-19. Have you seen that? Have you seen the manifestation of the stats here locally?
Yes, definitely. Particularly in our office, we were hit very hard in March, April, May timeframe. I would talk to some of my colleagues. In general, we would probably have maybe 3 to 4 patients die a year just because of the age of the patients. In that 3 months, I think we lost 12 people in our office. And not all of them were COVID related, but you could say that they were associated with COVID because some people were sick and for fear of getting infected didn't go to the hospital, delayed care. It just really was tragic, really tragic. So I'm hopeful with the vaccine and with the numbers going down that we can move out of this.
Okay, hopeful is a word that I grab onto. Perseverance, entrepreneurial. How have all of those words played into making sure people in the African American community get and have access to the vaccine?
I'll say one thing that's been hopeful for me is, one, looking at some of the national data, that vaccine hesitancy seems like it has, particularly amongst African Americans, has started to decline, particularly with some new data from the NPR, which is showing that African Americans want the vaccine at the same rate or even a little higher than a lot of our white counterparts. And two, personally, when I've seen patients come into the office, having to do a lot less convincing than I had to maybe in January, I think there's a greater acceptance of the vaccine, maybe because people have seen people or know people who've gotten it and are doing well. And then I think being very transparent with what symptoms you may have had after you had the vaccine. I mean, I was fortunate enough to get it and didn't have any symptoms. I've had friends, most of them younger in the medical field, who did have some symptoms for 36 hours, but they were also very transparent with that and still encouraging family members, friends, and patients to get it. So I'm really hopeful that the uptake of the vaccine is going to be a lot greater as we move forward, and that's going to help us get through this pandemic.
How big of a part does the history of Tuskegee play in, and maybe not a part, but how big of an obstacle is it in terms of trying to get a message out to people that this vaccine is not that?
Okay.
I think it played a great deal originally when it first started. That's all people were talking about. But I think that has kind of faded back into the back of people's minds now. What is prompting them is the fact that they're seeing that those of us who had the vaccine are still walking around. We're still alive. We're still able to do the things that we ordinarily do. And now the problem now, I think you might agree with me, is not so much fear of the vaccine, is getting the vaccine to the people is the big problem now.
Absolutely.
I agree 100% with what she said. I don't know if Tuskegee is even really that big of a challenge for us anymore. I think that we've all kind of gotten past that. I think that the bigger challenge is the misinformation that you see on social media. Prior to, in past pandemics, we didn't have access to social media. We didn't have access to everyone's opinion instead of facts.
And opinion reigns supreme.
Opinions make me an expert, so I can actually challenge a doctor who has facts and who has dedicated their lives to science and making sure that I'm safe. So that is our biggest conflict with COVID-19 and the vaccine.
So what are you running into? What are you hearing?
You name it, I've heard it.
Really?
Tentacles, you're going to grow tentacles from the vaccine.
You're going to get a chip from it.
A chip, yeah, I've heard a chip.
They're attacking you.
Oh my gosh.
They're trying to kill us.
Yeah.
They want to wipe out the black community. This is a prank. It's a conspiracy to
It's going to
keep
change
us
your
in a-
DNA.
to change your
Yeah,
DNA.
yeah.
I've heard that in my family.
Right,
You
and
know.
so we take that trust very serious. And some of it we agree that African Americans have standing to be hesitant when you think about health disparities. So it's not just Tuskegee. It's my experience when I go to the doctor, the intimidation, the birth defects and all of that. And why I say we've been entrepreneurial is because when we think about any problem, there's the substantive problems, but there's also the how and who is delivering the solutions. And what we've seen tremendous partnership with is, hey, Tropikana is not a doctor, but she has more social influence than maybe Hospital X, right? That people listen to her. The Urban League is a civil rights organization. It's not a medical institution, but we can lend our credibility and voice there. We partnered with the whiskey company to do PPE. You couldn't have told me that 2 years ago that would ever happen, right? So that's what I've been a little encouraged by, is forge these unlikely allies sometimes to really educate and radically mobilize our community.
Yeah, and created this
Absolutely.
instead of this,
Right.
right?
Absolutely.
Right.
Absolutely.
Okay, so we talk about social media being one of the obstacles to overcome. What have been some of the other obstacles to overcome in this whole process of rolling out a vaccine and making sure shots get into arms?
Transportation is a big problem for a lot of people.
Okay.
And we, at our church, we've taken people to get their shots because they want them, but they don't have a means to get there. So as the First Ladies for Health, we've tried to plan our events around areas where there's bus service, if they don't have cars. So transportation has been a big obstacle.
I would say scheduling. Before we were able to bring our vaccine program online, we would basically tell people to go online or to call this number, and all of them said they had difficulty getting through, whether it be online, calling, no one would pick up. So we became more intentional once we had access to our vaccines, where we would reach out to them and schedule them. And to a T, I think our show rate has been like 95% in getting the vaccines, which again, I think people want to get the vaccine. I think we just need to make it easier for them. Now the challenge is that it has to be stored at such a cold temperature that you can't do it in all the areas of the community, because quite frankly, we would have loved to have given it in our office. But I think with some of the newer vaccines that are coming out that can be stored at just refrigeration temperatures, that's something that we would like to do.
Okay. In terms of, we talk about the challenges of getting people to sites. Is that just one thing in a constellation of things that gets in the way of equity where vaccines are concerned? Okay.
Yeah.
What are some of the other things?
I mean, trying to get to their doctor's appointments.
Transportation, the information,
Yeah.
access. For a lot of younger people, we don't have access to the vaccine yet. Some of us don't. We can't get it until it's released to our age group. A lot of people aren't keeping up with what's going on. They don't know where the credible sources are to get the information that they need to find out, where can I take my mother to get vaccinated? Who do I call? So that's been an obstacle as well, making sure that we get the information out there to the people who need it the most.
What do you see as the fix for that? Because it's, I hear that and I think to myself, gosh, we're on the air every day talking about
Every day.
COVID-19. What can we do differently or better to make sure that we're hitting ears?
I think that it's exactly what you're doing right now, coming straight to the people and talking to them where they are. It's been difficult because we can't actually talk to people. We have to socially distance. But prior to COVID, we'd be in the streets right now, handing out things, making sure that we could pull up and do a drive-through facility where you can get vaccinated or you can get testing. I think that what you're doing right now is the number one way that we can kind of change that, as well as what he said as far as unifying the different organizations that you wouldn't usually see together.
Right.
You probably would have maybe never saw me before on this panel in particular. I'm so grateful that we are here because this is what it takes to get people the information and access.
Okay, the next question I think is an important one. We've talked about older populations, but how crucial is it that the vaccine message reaches younger African Americans?
It's very crucial. And the one thing that I think that my demographic really needs to understand is that this vaccine is nothing new. This is not the first pandemic that has ever hit America. And it baffles me that we don't remember that we had to be vaccinated to go to school. You've been getting vaccines your entire life. You've never had the measles, you've never had the mumps, you never had rubella. Did I say that right, doctor?
Amen.
You've never had to have any of those, and it's because we got vaccinated. It's not new, it's not a trick, it's not a conspiracy theory. This is just our generation's pandemic. And stay off of social media, listening to your friends and their opinions, because they're your due diligence and do the research. And remember that you have to have vaccines to do anything that you've done prior to.
Yeah.
It's not new.
Yeah.
True.
It's
Not
interesting.
It's true.
With some of the younger folks we work with, when we started to talk about there may be a travel vaccine, it's like, oh no, I can't go somewhere for spring break, maybe. You know? So it's just a different context on it. And I think it's what we have to do from a process standpoint is when people are ready to get vaccinated, that it is easy to find where, that there's easy to schedule an appointment, you know, and that's been the biggest, I think, failure that we've had. And I think to the state government's credit and to definitely Commissioner Moore, they've been phenomenal in adapting of saying, here's a problem we've identified with registration. Okay, well, they're going to open up a hotline. Of like, well, we still don't want to talk to anyone from the health department. Okay, we can use volunteers to call and help walk people through appointments. So it's just iterating over and over again. And you got to remember the eligibility changes from week to week, and there's a lag time every time. I mean, they just announced 40 today, right? So we talk to people who are saying, "Oh, I still thought it was 65 and up," right? Because there's a lead and a lagging indicator there. So we're just trying to do our best to communicate that breaking news so people can know they have an opportunity. And I think part of it is just it's okay to be hesitant. You know, there's so much. This generation has so much things that they are consuming on a daily basis.
Information right here.
Right, and then worse is, you know, whatever we like, we see more of. So if we think it's a conspiracy, we'll get push conspiracy things, right? So it's just appreciating that, right, and continuing to double down and educate and show that everyday people are getting vaccinated, and they're fine. They're walking around fine.
I think there are a number of community leaders that we probably don't use enough, like our hair salons, our barbers, who are
Our day-to-day lives.
strong community leaders and influencers. And I know in Maryland, they've done this a lot, working with barbers and hair salon and hairstylists to get them on board with the vaccine so they can talk to their customers and actually provide accurate information about the vaccine as a way to help them increase uptake. So I think we haven't reached all the individuals that we need who are going to be leaders and community influencers. And I think that's an untapped group that we probably need to touch a little more.
Okay. In terms of the challenges ahead, now that we are opening up the realm of vaccination to just about everybody as of March 29th, how do you anticipate moving forward in that new world order in terms of getting a vaccine message out and making sure your community hears it?
We stream every Sunday and Wednesday, and we usually have about 1,200 people that watch those streams. My husband does sermons on Sunday, and he never ever does anything without mentioning getting the vaccine. Surprisingly enough, the congregation that we had Sunday, he asked everyone who had the vaccine to raise their hands. Everybody did except for the little children.
Oh my.
Excellent.
So
Excellent.
it is, and the word is getting out there. People want it, but I think, as you had mentioned, the problem is in getting an appointment.
Yeah.
So we've had our staff here and people from home trying to get people registered. That's the big problem now. It's not a lack of wanting the vaccine.
not at
It's
all.
getting them an appointment. And
So-
even though you see the thousands that are coming down the pike, it's still hard to get an appointment.
And that could be, to some degree, still a supply and demand issue, right? So when we get beyond the supply and demand issue, do you think it's going to be a challenge still or no?
I think it will be a challenge for some of our younger individuals. But again, I think community influencers can help with that. I think using a lot of technology, posting accurate information on Facebook and Twitter, which our young folks tend to live on. I've got a son who spends most of his time on it. And I think those kind of strategies, I think, will really help to change the minds of some of our younger folks. Because one of the things that's always been surprising to me is when we talk about Tuskegee, the people who are bringing it up are people who are under 40. No one who I've talked to try and convince to give it the vaccine who's 65 and above brought up Tuskegee, which was kind of strange to me because those were the individuals who may have even known someone who'd gone through the Tuskegee experiment. So I think we just have to use social media as a way, social media
A force
blitz.
for good.
Yes,
Okay.
to really encourage people to get the vaccine. And again, there's going to be some mandates. Like if you're in college, at some point they're going to mandate that you have to get the vaccine because they already do that for several other vaccines. And if you're in the hospital, I think at some point that's going to be strongly encouraged that you get the vaccine, or you're going to have to go through regular testing. And anyone who's been through testing doesn't want to do that on a regular basis. It is not comfortable.
No. I do have a question for you. Let's take a critical look at how the tri-state has handled vaccine dissemination to minority groups.
Yeah.
How would you rate how the tri-state has done on that front?
I would say, I will lift up Kentucky. I would say that they've done an excellent job of zeroing in. We serve Northern Kentucky on essential workers. You know, part of I would say, when you asked that earlier question about how this last year has been for an organization that focuses on economic empowerment, it was really frustrating because we really glorified essential workers. And I'll never forget one of the people who we helped said, you know, people are saying I'm a hero, but I have to work.
Yeah.
I want to work from home. I have to. This is not a choice for me.
Yeah.
So, of course, it was a little disappointing to us when the rollout came that we didn't get to essential workers faster, right? Because those are the people, I understand it's a both and, not an either or. We should definitely target our seniors, but those who are more susceptible, who are keeping our economy afloat, who are risking their lives day to day, you know, should have followed suit with some other states on prioritizing those groups first.
Okay. Okay.
I've had some meetings with Commissioner Moore, and I have to say that she is forward-thinking, and she's
Absolutely.
accepting any ideas that are
Yes.
practicable to help roll out all of these. And that's one of the reasons why the First Ladies for Health got involved, is through Commissioner Moore, because she wanted to reach more people where they are. And so I do have to give her credit for
Yes.
being forward-thinking.
I absolutely agree. I believe that Commissioner Moore has done an excellent job. I think that some of the other organizations, like Closing the Health Gap, the Center for Closing the Health Gap, and Renee Mahaffey Harris and her team, the things that they have been doing to get the information out and creating places with resources for information that's credible has been excellent as well.
Yeah, I would say probably we're at a B. I think we started off slower than I would have liked. I think the pace has really picked up. I think a number of organizations have been included and partnered with in order to help reach communities of color. And I think as we move forward, I think things will be even better. So
Yeah.
I would give us a good B.
Okay.
I have to comment on that. I think the response, we might have not started the strongest, but the response has been phenomenal, particularly on the local level. Again, Commissioner Moore has been great. I mean, we're doing pop-ups now, drive-throughs, mass vaccinations, calls directly, closed pods, and these were things that did not start off in the beginning, right? It was just, here's a website, here's a QR code, right? Go register. And to look back to where we are from now has been just really a testament when we talk about being entrepreneurial and flexible to try to creatively problem solve. It's been great.
Yeah. What do you say to folks who say, and I've heard this, people have written me, there is no vaccine equity problem. What do you say to folks who say that?
Sure, the data, you
You
know.
look at the data.
So, you know,
Right.
the data.
You just
Yeah.
look at the
Look at
data,
the
whether
facts.
it's Montgomery
Yeah.
County or
Yeah.
Hamilton County, when you look at a per population, you can't really explain that with hesitancy alone.
Correct.
Right? And we're on the ground and we hear it directly from people of, I couldn't register, right? What is a QR code? You know, I got my first one, but I need transportation to the second shot. So it's all of these things, and they are system problems, right? People feel personally attacked sometimes when you say there's an inequity, but when you do anything that is a equal process, sometimes system problems emerge.
Like assuming that everybody's online,
exactly.
Right.
Absolutely.
Right.
right?
Assuming
Right.
that everybody has access to the internet, like you said, the access. If you don't live in different neighborhoods, or if you don't live without. A lot of people, like you said earlier, were affected differently during COVID, where you didn't lose your job. You don't live in a low income neighborhood. Just here in Cincinnati, we had thousands of kids who didn't have access to the internet to be able to go to school from home. So the same issue still lies in this situation in regards to getting information quickly and on time with access to the internet.
Well, I had somebody write me who is African American who said, I don't know how I'm going to afford to get this. And I wrote her back and I said, it's free.
It's free.
And so there it's the messaging, it's the constant getting the information out. So why is it important that you do not take your foot off the pedal at this juncture?
To save lives.
Yeah, to save lives, you have a right to live, and you build and strengthen your credibility by consistency and doing it. Just like the First Lady said, every Sunday the pastor is talking about vaccination, and that is a direct correlation to the vaccination rates, right? And when you use your personal credibility to keep honing in that message, you will see the change will bear out in the data.
I've had people to say, I wasn't going to get the vaccine until Pastor said I should get it.
Absolutely. Absolutely.
And there is the leader in the community
Right.
leading the charge,
Absolutely.
taking the message and putting it out there. When we take a look at our vaccination numbers of the African American community, are we doing better here in Cincinnati than in other places? What do you know about that?
That I don't know. I think as a state we're lagging. When you look at the percentage of African Americans who've gotten vaccinated versus percentage of the general population. Specific to Cincinnati, I'm not sure though.
Okay, that's something that I'm going to look up for the purpose of this story and when we introduce it and everything.
Yeah, we're getting better. Part of it is one, to make sure that all clinics and all providers, one, collect data around race. That was a problem during testing. So it's getting better.
So they didn't collect data?
Some did not, or some, some patients will say, I don't want to give my race. So they're categorized as other, right? So one, just better data collection habits. And I think the state has been working tremendous on this issue. So it's gotten better over the past month for certain, but we have a long way to go, and I think we just don't take our foot off the gas.
Okay. We have about 2 minutes left. I'd like each of you to speak directly to your people and just say what you would like to say. This is your opportunity to talk.
Well, for my listeners and my friends and family, I consider them friends and family. We share our business together daily. You call me and tell me your business, and I tell you mine daily on air. It is so important that even after you get your vaccine that you still wear your mask. It's so important that prior to getting your vaccine that you continue to socially distance and wash your hands and take it serious and understand that this is a priority. That just because you may not feel like you have symptoms where you need to go get a vaccine, it's so important that you protect the others and have a personal accountability for the community around you, for your children, for mine. If you've been partying and hanging out, remember that it's not just you that's affected. If your child, if you catch COVID and you give it to your baby, and then you send your baby to school, and he's sitting next to mine who has congenital heart disease, you could kill my child. I could take him to my mother, and his grandmother has underlying symptoms. You could kill my mom. So remember that it's really that severe, it's that serious. And a lot of times we just feel like we're invincible because from 18 to 34 you can fly, you can do anything. But it's important that you take personal accountability to save the people around you by preparing and saving yourself.
And I just want to say, piggybacking, that if you won't get the vaccine for yourself, get it for your loved ones. Protect your loved ones and protect your community.
Sister Barbara Lynch.
I am anxious to get back to a point where I can be in the company of people that I love and people that I want to have lunch with. And if you don't get the vaccine, I can't do those things with you. I am tired of going to funerals and helping people through the grieving process. So we need you to get the vaccine so that you can have a normal life as well as I can have a normal life.
Final thought, Eddie Cohen.
Just you have a right to live. You have a right to be protected. You have a right to thrive. And there is deep partnership both from the state, the medical community, community organizations, everyday people to make sure that you have access to the vaccine.
Make sure that everybody
Yes.
who is part of the same human family
Yes.
Right.
has access.
Right.
Absolutely. Absolutely.
Okay. Thank you all for joining us for this conversation. I really appreciate it.